All right, students online. Glad that everyone is already here. Got a couple of people that may come in a little late, um, but we are here and glad of it. On this beautiful Sunday, I get a chance to share one of my close touching stories that happened. Hopefully, you guys can hear me clearly. I got a new mic, little setup, and everything. Just give me a little check in with everybody that's online. Let me know that you can hear me clearly before we get started. Um, the story is kind of touching to me. Um, Everybody probably had some type of mental health family member that they might have had in their life. You know, a friend or family, somebody that's close to you. All right, great, great. Everybody can hear. Somebody that's close to you that um, you loved. You know, this is a loved one. Um, for me, I was around 10 years old, 11 years old at the time when my big cousin went off to the Gulf War. Okay. I already kind of told you guys about this when we was talking about anxiety a little bit, but my cousin, was a very smart young man. At 10 years old, I didn't know all the things that I know now, but, yeah, please. Um, he went off to the war at the age of 20 years old, drafted in. You know, most black men would say that they go off to the war because they want to take care of their family. You know, they want to have some security, financial security, and everything. So, um, cousin Lorenzo, we call him Boot. But Boot went over there, and he came back within like a year and a half. This is the Desert Storm, Operation Desert Storm, Gulf War, and a lot of people, a lot of soldiers came back with Gulf War syndrome. This is a lot of neurological issues that they were going through, insomnia, chronic fatigue when they came back. And Boot got classified as AWOL when he came back. Actually discharged AWOL, came on back, and then classified as schizophrenia. So within this Gulf War, I remember this time. My mom was scared to get the mail in her mailbox because of anthrax, right? There was an anthrax vaccine that was given to all the military service members out there. And also, they were dealing with mustard gas. Remember, I told you guys about the mustard seed and how the gas that it lets out. This was a chemical warfare. And most times, when they have these foreign wars, they are using chemical agents to kind of change your neuronal activity. A lot of people have came back with PTSD simply because of that and have been classified as schizophrenia. So I got a chance to see how my cousin behavior was. Matter of fact, by the time I was around 23, I had to live with cousin Boot, and I was operating a transit company. I had my own little transit business, and I would have to pick Boot up from the train station because Boot would always go out looking for substances to abuse, you know, find a way to help balance out his fears, his delusions. And out there in the streets, he would find himself either wanting to be homeless and out there finding the things, and then he'd come back to home where my auntie would take care of him. So this is his little cycle. He would go in this cycle of being on medications, then going out into the streets. Nobody see him for about a good 3 to 6 months. And then he come back home and stay for about a good 3 months, 6 months. He stays in his room a lot. And he would have these delusional thoughts. He would be talking to himself. You know, he wouldn't even come out. Probably use the bathroom in there and everything. But my auntie would always take care of him. And he would be making these strange body movements and strange noises, inaudible noises that we really don't understand. But I really understood that Boot had some mental issues, and this was my first time ever being around somebody that had schizophrenia. So, of course, he was on antipsychotics, and they would keep him stable for a little while. but he would end up going back out there looking for those drugs, of course. And being a veteran, it's not much that they would do other than just give them a small little check per month. So as my auntie was the caregiver, she was able to look after him and keep him straight for a little while. You kind of got to give them their freedom. You kind of got to give them their freedoms to do what they do. They're going to isolate themselves. They're going to find their best psychosis in the streets, in homelessness, or in jail. That's where they are. That's where most schizophrenics are. But just to keep on going with this, Boot will be looking for me to pick him up from the train station. Almost whenever I see him up there, I know I gotta take him home. So, but this business that I had, around the age of 23, 24, 25, I ran a transit company picking passengers up from the train station, taking them to the county because we didn't have transportation. And I end up meeting a whole bunch of people, finding out that I had healing abilities. If you guys go back to my video about lung health, you'll find that I help heal a lot of people from asthma, diabetes. I started right then in that area, around 23, 24. I had this helpful spirit just to service people because I was basically helping them get to their jobs and everything every day. And I met this girl. She was just a passenger. And of course, me being nice and everything, helping people, take them where they need to go. But she got to the point where she would want to ride around each route. And this particular day, I could not ride around because it was too busy of people calling my phone saying, meet me back at the train station. So she ended up saying, I don't want to get out the van. I don't want to get out the van. And I was a little tempted to say, hey, it's time to go. It's the end of the route. You have to get out the van. And she rode around twice, that full route. And my routes was, at that time, was around 30 to 45-minute routes. And it was time for me to pick up Boot, and I wanted to take him home, and we get some food and everything. And this girl did not want to get out of my van. And it got to the point where she stopped listening to me about getting out the van. And as soon as I turned around, before I knew it, she was strangling my neck. Okay. And I had to really just thought that I was fighting for my life at this time because I'm in my driver's seat driving and I get strangled. And I stopped abruptly and trying to get control of the situation. And I couldn't because I figured out my phobia is myself. My phobia is claustrophobia. Okay, so if somebody's putting their hands around my neck, it's going to kind of make me get a little outburst as well. So I'm not really an angry person. I keep myself calm. But during those times or irate moments, and I'm telling this person to get out my van and she would not leave, it ended up being a little fight in the van. Okay, me trying to protect myself, me trying to get this person out, and I'm handling my business. And this strange moment happens where a police was driving by and they automatically thought that this was a domestic violence issue. So I end up going to jail because of this issue. Now I found out that this person 2 to 3 days later after I bail out of jail, that I do a public health records request. I played like a lawyer most of the time during those times. And I was able to find out her medical records and found out that she was schizophrenic. And she was ordered not to ride in my van anymore, or restraining orders were put in place and all those things. So I give you all that background little story about me, also about schizophrenic people, because you cannot control everybody's behavior, their moods, their whatever they're going through at that particular time. These people are hallucinating, they're delusional, and they also are saying things in different patterns and thought patterns that are out of the ordinary. It's very different from normal people's thinking. Okay, so what is it about the schizophrenic brain that is so unorganized. Their behaviors are erratic. And if they're going to have an episode, they may be quiet for a little while and then burst out. But during those times, guys, I wasn't as emotionally intelligent as as I am now back then. So I just wanted to share that with you guys and go into some of the facts and what schizophrenia really is. Schizophrenia, schizo, root word, it's Greek for splitting. Phrenia is mind. So schizophrenia is the splitting of the mind. All right. So metaphysically, you can't say that they have a split personality. All right. This is all the same mind, but their prefrontal cortex is damaged, so they will alternate from different realities. Okay. So if you're talking to them and they're jumping from topic to topic, they can see something that engaged them, say that butterfly or this train is passing by, and you're talking about a conversation about your healing, then you can't really have a full conversation with this person. Their patterns are too off balance. Schizophrenia affects 1 out of 100 people between the ages of 15 and 35. 15-year-olds to 25-year-olds, they're mostly men. 25-year-olds to 35-year-olds is mostly women. Okay, these people have these muddled thoughts, changes in behavior. They have this flat effect. This flat effect meaning emotionalist, non-enthusiastic, I won't initiate anything, I don't care type of attitude, behavior. All right, flatness, emotional flatness. They go through depression. They hallucinate. And these are not like regular hallucinations, guys. These are, I hear somebody I'm hearing voices, right? I'm hearing things tell me things that to do certain things or to say certain things. I'm seeing certain things that other people can't see. So those type of delusions. Okay. Now 10% of these people, they will commit suicide. 10% of those. Now, as I'm saying, 1 out of 100 people, that's 1% in the United States. Now, I'm not even talking about worldwide either, guys. It's way more than that. I would just imagine the third world countries having a lot more of this. And this can be also environmental. Think about those countries that don't see the sun as much, right? The seasonal depression that happens when they don't see the sun. Those countries that don't, near the equator, they might not have as much as the depression or the schizophrenia. Okay, so just want to throw that in. But you can see this on the brain scan. You can see their thalamus changing. You can see the ventricles being a lot smaller. You can also see their prefrontal cortex being damaged. There are actual physical changes that are happening in the schizophrenic brain outside the normal brain. So this has been proven. You can check the research on that. I wanted to break some of the myths about them being violent. They're not really violent. They would choose to be homeless and leave everybody else alone. They would choose to go off in their little room like my cousin did. Don't bother nobody. If they're trying to find substances like crack, which was the drug of the decade, right? My cousin, that's what he was searching for. They've had studies of those having LSD trips, having these type of episodes, but they will become violent if they have those substances. And the withdrawal and not being able to get to those drugs will cause them to be violent as well. So these are things that help comfort them, right? So types and characteristics. I wanted to let you guys know that you can go on YouTube to find all the types, all the characteristics, all the different mind hacks that they have for schizophrenia. All right, this is not for that. That's not what we focus on. We focus on healing, the things that YouTube can't teach. Okay. All right. So I just want to give you some resonance behind the types and characteristics so that when you see these things on YouTube and you further your information, you'll be able to classify them in the same direction And then you'll know these unknown causes that they're not talking about. All right. So most positive symptoms of schizophrenia and schizoaffective disorder, they have these same things, the negative and the positive. So the hallucinations, the false beliefs, the delusions. Um, Let me give you something about these false beliefs, guys, because delusions, there's a whole delusional disorders. There's different types of delusional disorders. There's what they call persecutory delusions, when someone believes that somebody wants to harm them, right? Or they believe that like the targeted individuals, TIs, they will kind of believe that the frequencies are attacking them, right? You also have those people that have these erotomaniac delusions that they believe that one of these celebrities love them. You know, there was a show, Swarm. Well, this girl thinks that Beyonce really loves her, and that's the celebrity worship syndrome I wanted to kind of share, but we kind of changed our direction on that. But there's different types of delusions, guys. There can be the man that believes that his wife is cheating on him, and she's not, and it can be very, very diluted. So just wanted to throw that in there. But we already talked about the disorganized speech and the thoughts, abnormal body movements, the agitation. They can feel like something's crawling on them, crawling inside of them. They have this, what they call parasite psychosis, or what they call delusional parasitosis. The negative symptoms is the anhedonia. Anhedonia basically is the lack of pleasure of life. These people feel worthless. They don't feel like they want to be here. No pleasure of life at all. They have this very much of the social withdrawal. I already talked about emotional flatness, and I'm going to be relating these negative and positive symptoms with a lot of the causes here. All right. These people also, they lack self-care. You may see that these people don't care about their hygiene. They don't care about their financial situation. That's why I said these people are mostly time homeless, or they have a caretaker, or they're in jail. They have a lot of trouble completing tasks. They don't initiate the task. They don't, if there was an activity they're trying to get to, they don't finish it. Some of the cognitive symptoms that they have, same thing, their poor decision making, the decreased executive function is like they need somebody else to make decisions for them. They can't focus. They have memory loss. Like I said in my little snippet, that you can be screamed at and yelled at, and they won't even remember that they've done that to you. All right. And they have no awareness that they have a mental disorder at all. Okay. So those are some of the types, characteristics. You guys know that last week I gave you guys the pyrrole disorder, this chemical substance that is made inside of our microbiome that attaches itself to vitamin B6 and zinc. And it takes those out. It diminishes those vitamins. And that's another way that 30% of the schizophrenics have what they call pyroluria. All right. You understand that pyroluria is right here. Is a pyrrole disorder. You can get your urine tested. I'm going to post the lab clinic in Colorado and Arkansas that does these tests. You can send off your urine to them, and they can check for cryptopyrroles. So symptoms of pyroluria, they will have this fruity breath. They've got a sweet smelling breath, like maple syrup, or like kiwis or oranges, something like that, citrus, fruity breath. And they come with this musty body odor. They also, they have a loss of appetite. They don't feel like eating. And that's mainly because, you know, most schizophrenics have gastrointestinal problems, and we're gonna go over that in a second. But also, they have a problem with metabolizing their sugar. This could be the type 1 diabetic that also is schizophrenic. This person also is subject to more of a cold and flu allergies. We already know what histamine does. And there's another name that we're going to give for histamine in a second. This also person goes through delusions, hallucinations, paranoia, amnesia spells, and low stress tolerance. We already know that B6 and zinc is the issue for the pyroluria, and all you got to do is just add some more B6, and I would do a double dose of that. I think that about 250 milligrams of B6 and 75 milligrams of zinc would be okay. We'll probably go give some solutions on that in a second. Everybody knows that a person gets very irritated when they go through low blood sugar situations, right? They get hungry, they get faintish, they go through mood swings. Hypoglycemia is their issue. It's a very common condition, but they don't really associate it with those who have mental disorders. Being that they don't like to eat, they got a loss of appetite, you already know their blood sugar is low, right? So these people are going to have these mood swings and fighting the fact that they want to eat. So I call it like a random delirium, and it's acute. These hallucinations are from being hypoglycemic. So anybody can really have this situation, Anybody can have that situation along with other things happening. Say, for instance, they were being drug intoxicated with the hypoglycemia. Then they would go into a psychotic episode themselves. So you got to make sure that their blood sugars, because it's going to fluctuate throughout the day. But if they have an issue like the type 1 diabetic and can't control their blood sugar, it gives them more reason, especially with the drugs circulating, to have a psychotic episode. So I think a lot of this is going on because of pharmaceuticals. Also, because when a baby is born, they give them vaccines. Some cerebral flow is decreased. All right, some damage can happen then, and this is what happens a lot of times when we're going to talk about autism. But and of course, these things happen because of the mother's hormonal differences as well. She can impose or induce anxieties, fears, and also a little bit of the, I would say, lack of neurotransmission in that baby's brain. Because the brain is still developing. So let me go into histopenia. Histopenia is basically hista is histamine, and penia is a deficiency. So the histamine deficiency in the brain and body, this happens in 50% of all schizophrenics. Okay. The patients also have high copper levels, right? And copper levels, this is very similar to what they have in Wilson's disease. Dr. Samuel Wilson is a biochemist. They named it after him. With this situation with Wilson's disease. This is when your liver is accumulating more copper and it won't come out. Copper actually decreases the amount of histamine. And you got to get this out by adding zinc, right? And also adding vitamin C. So I will let you guys know that zinc it has to balance out zinc. Zinc balances off copper, and vitamin C also can chelate it out. Now, this can be a very big problem, guys. Histopenics, their classic signs is always feeling inflated self-confidence. They have a grandiosity complex, but they also have these racing thoughts and hallucinations. These people, the histopenics, that's what we call them, The histopenics is basically a histamine deficiency. They have a difficulty orgasm during sex. They also have suspicion that people want to harm them all the time. Okay. So as you're learning about these different unknown causes, you'll find that this is more biological than psychological. All right. Yes, there are some psychological issues here, but when you have these biochemical imbalances, they're inducing these psychotic episodes. There's another. So Wilson's disease happens to find more in Caucasian. All right. Thalassemia, I didn't put this up here. I'm going to spell it out for you guys. I'm going to spell it out right here. Thalassemia is found in most African American, I would say melanated people. They will have this excess of copper, and it needs to be chelated out as well. So when your blood histamines are low, this makes a bigger event for your psychosis to happen. So remember that about thalassemia. I'm probably going to test you guys on thalassemia soon, even though that's just a part of the histopenics syndrome. Another one is called histodelia. Hista, we all know that's the histamine, and delia means the excess of. So when there's too much histamine, the blood and the brain, it affects mostly 20% of our schizophrenics out there. All right, when there's too much histamine. So this person has compulsiveness, OCD, or obsessiveness. He can go through these blank, flatness, emotional flatness. He also has phobias. This person is kind of anorexic too. Got a real rapid metabolism. And he don't really have headaches like that because he has so much histamine. It's usually when the low histamine happens, that's when they have these headaches. Yeah. So this person also goes through chronic depression, and they're more likely to have these suicide tendencies. Very hyperactive person too. Yeah. So these people get a lot of thrill. I guess they have to be active in a lot of things. But they can't take pain. They cannot take pain. As I did further research, they bruise very easily. All right. So having too much histamine can also create some mood swings, psychological effects as well. All right. I'm getting further on down about these unknown causes. Cerebral allergies. A lot of people don't think that they have brain allergies. Brain allergies can come from different foods that we eat. We know that when the brain becomes inflamed, it has to be some type of reaction. And I would say grains. That's why they used to call this back in the DSM-4. DSM-4 and 3 back in the 50s, they had something called bread madness. Bread madness was when the grains would create candida, yeast. They create mycotoxins in the brain. And you know that the gluten and zonulin will cross the brain barrier, and it will be able to react with these type of effects like extreme mood swings in one day, hyperactivity and psychosis. They can be aggressive, irritability. So wheat and corn is basically a grain. So get off the grains, people. Get off the grains. I'm always going to dive in and keep telling everybody that the grains is very toxic. We got classes on toxic grains, but you already know I don't want you guys to be eating that. I gave you guys a little cocktail in the group about grilled cheese sandwiches. You're basically having the bread, the cheese, and the milk. Well, the milk has morphines in it. All right. The wheat has the gluten in it, so gluteomorphines. is a neurotoxin. So that creates an allergy for the brain as well. It creates inflammation. That's also going to create something called celiac disease. Everybody knows that celiac disease can basically, it's a bacterial overgrowth in the intestinal lining. Your gut becomes permeable, and that leaky gut situations goes directly to the brain. So those are another way to get that candida in your brain, always feeling brain fog, depression, mood swings. I had something to tell you about the tobacco. So if you see a schizophrenic actually taking in tobacco, tobacco has a way to, because it's nicotinic acid and it's very addictive, keeps them addicted, keeps them in the hallucinated state. And also it calms some of their nerves, but it keeps their delusions going because they can't really, like, if you can't get to the cigarette, it creates those withdrawal symptoms. So I find that tobacco is very 75% of the schizophrenics have these addictions to the tobacco, and it's not a good thing. The hydrocarbons. If you guys don't know what hydrocarbons are, these are ethanol compounds. So just going to the gas station can trigger in their chemokines, which is the olfactory system. What you smell, these are chemokines. Those hydrocarbons go into the brain and they can create a trigger of a manic episode. All right, so this is just research that I found within the cerebral allergy situation. Okay, so you get about, I don't know, probably about 3 or 4 different diseases and conditions just from dealing with bread madness. All right. Now, I've been talking heavily about drug intoxications. We know that, I don't know why people do this. Why do you have a pain reliever? Okay, you got a muscle relaxant, and say you got a laxative at the same time. You take all 3 of those in one day, shouldn't you go through some type of acute delirium? You know, you take Miralax, laxative, a pain reliever, a Tylenol or something like that, and then turn around and take a muscle relaxer or an antibiotic. You're definitely going to create some interactions. So it's many people that have these non-psychotic drugs because certain psychotic drugs, they have theories, okay? They have theories that they're trying to say that it's associated with, the like clozapine. It's an antipsychotic drug. And it doesn't create the hysteria, the craziness, I would say, but it calms down dopamine. So their theory is to say that dopamine is overstimulated and they want to block the receptors with the clozapine. All right, so, but I don't think that theory is correct. It's not all about dopamine. There's many other things that got something to do with just one neurotransmitter. But in this situation, there was a combination of antivirals, Parkinson's related drugs, and autoimmune drugs that were combined with an antibiotic, and they automatically got confused. They get this jitteriness, these hallucinations, and also suicidal behavior. So that is a lot of people that's going on when they have multiple different drugs they're taking, and they can induce what they call it's just a psychotic episode. Yeah. I found out furthermore, dealing with dialysis patients, learning a lot about what's going on inside the dialysate, which is the fluid that they're using to help cleanse and circulate in their system when they're going to dialysis. And I found out something called the brain disease, encephalopathy, which is your brain starts to degenerate slowly. And it's just because of all the aluminum that's inside of the dialysate. So that dialysate lodges in the brain, aluminum levels, and they can create those tremors, those convulsions, those changes in their speech, and you will notice that they feel confused while they're on the dialysis machine. And the best way to get that out is just go through a chelation method. You can, you can take something 30 minutes afterwards, but maybe some herbs and something like that that can help them 30 minutes afterwards. But you want to get on a chelation method to get those metals out. Once those metals go away, you'll be able to that confusion goes away. Another thing I found is that the delusion of parasitosis, they think that something's actually crawling in them. They will be itching and doing little body movements and stuff like that, but there actually is a parasite that is associated with schizophrenia. I told you guys in my parasitology class that about this parasite, and it crosses the brain barrier. I don't know if anybody paid attention to that, but I actually got infected with that same parasite, and it affects different people in different ways. So this parasite actually gets inside the brain. It's called Toxoplasma gondii. This is a cat parasite, guys. It comes from different cats, comes from their feces. If you got cat litter in your house, yeah, this is one of the parasites that's definitely a part of schizophrenia. And it affects a fifth of the Americans. Yeah, a fifth of our population, and people don't even know it. All right, so it's very easy to get rid of this parasite. You can easily just take some wormwood. Yeah, some wormwood. I got wheatgrass up here, but I picked the wrong one up over there. But yeah, wormwood helps. Oregano leaf, black walnut, all that would help get rid of that parasite. And this parasite has to come out of the feces, and it's not going to come out of the glymphatic system. Glymphatic system starts with a G. Okay, so your glymphatic system washes your brain. It is the only fluid that washes your brain. All right. So many people would think that that fluid has to go through the lymphatic system, but it doesn't, because it doesn't come out of your urinary system. But cysticercosis, this parasite right here, you can urinate out. Cysticercosis. But cysticercosis doesn't cross the brain barrier. You'll find cysticercosis actually inside of the gut, and it'll actually change your microbiome that affects the brain. So this is one of the somewhat causes that they don't believe, because they think that these people have delusional parasitosis. But I guess the itchiness, the strange body movements, they would think that these people just have it in their mind. It's just in their head. So I recommend using some type of anti-parasitics. So use the herbs to help with that situation. Now, let's get into some of the other solutions, guys. Some of the other solutions here. We got to practice mindfulness as we are trying to manage our behaviors, understanding what's going on in our day-to-day life and the people that we want to keep in our day-to-day life. If you want to maintain connections with your family and your friends, you definitely got to learn some coping mechanisms, some mindfulness, and you can meditate to get yourself there. So this won't happen well for the undermethylator. It'll happen really good for the overmethylator. All right, that's the person that's really manic. That's the person that's hyperactive, and that person definitely needs to learn some coping, some meditation mechanism. All right. The person that is undermethylated, the one that has low histamines, he needs to he needs to be able to control those impulses. So that's why I'm saying learn some mindfulness. All of